Thank you for joining us. We will now begin the event.
Hello, and thank you for joining us for the spring semester town hall for Vanderbilt University students. My name is Ashley Brown, and I'm the director of the Student Center for Social Justice and Identity. Today, I'll be moderating this town hall, and I'm excited to be here. I'd like to first start by introducing our panelists for the town hall today. We have GL Black, Vice Provost and Dean of Students, Pam Jones, Associate Vice Chancellor for Health and Wellness and co-leader of the Vanderbilt University's Public Health Central Command Center, Jamie Hardy, Assistant Director in the Office of Student Care Coordination, and Andre Churchwell, Vice Chancellor for Equity, Diversity, and Inclusion. We will be taking questions that were submitted in advance of the town hall during the Q&A session with each of our panelists. Additionally, we have enabled Zoom's question and answer feature during this town hall so that we can take live questions. I'd now like to welcome Vice Provost Black to say a few words.
Thank you, Ashley. Good evening, everyone. Happy New Year. I hope everyone has had a wonderful winter break. Over the past 2 years, if we've learned anything, it is how to be adaptable in the face of continually changing circumstances. And once again, COVID-19 has changed course on us a bit, and we in turn have had to adjust our plans for the start of the spring semester. This has all been done in consultation with our public health team and also takes into account the changing CDC guidance. We have been and will continue to actively monitor all of the data that we have because we're still learning about Omicron. Though it does appear at this point to result in milder symptoms than some of the previous variants. So as you know, we are strongly encouraging everyone to get boosted as soon as they are eligible to continue with our high vaccination rate on campus. And for spring semester, we will have a return to campus testing requirement whereby students will need to submit a negative test result within 72 hours of their return. We have delayed the start of classes by a week. And we are going to have a brief Commodore's care or quiet period where we're going to ask everyone to focus only on essential activities and interactions while we get everyone back to campus safely, resume operations, and monitor any issues that may arise from travel. We are going to reinstitute some of our more rigorous masking requirements, and we also have some updated testing protocols, which Pam Jones will talk about a little bit later. At the end of the day, we know this is very challenging, and we know this is going to be very challenging for everybody emotionally. And we have our colleague Jamie Hardy from the Student Care Network, who's going to share some information about health and wellness resources. We also understand that people have varying viewpoints about all of this. Right now, we're asking everyone in our campus community to come together as one Vanderbilt once again to work through this. We hope that this revised strategy will allow us to move past any Omicron variant surges that are expected this month so that we can get back to where we were in the fall when we had gotten into a really nice rhythm, plugging along, really meeting our goal of preserving the in-person student experience as much as possible while also being cognizant and respectful of the health and safety of our community. We really appreciate everyone's patience and understanding as we continue to navigate COVID-19. I'll stop there, Ashley.
Thank you so much, Vice Provost Black. So I'd like to jump right into our questions, which include questions that are submitted by our students. My first question for you is, you spoke about some of the changes to the protocols for the spring semester. Can you tell us a little bit more about the reasoning behind pushing back to the start of the spring semester for students and the reasoning for continuing some graduate program start dates as originally planned?
Yes, so the university really closely evaluated the academic calendar for the spring, really to see what kind of flexibility we may have while maintaining two key things: spring break, which we really felt was necessary for people to have that time off during the semester, and also preserving graduation. So we were actually able to shift a week, and that would allow us more time for return to campus testing protocols, people who may need to complete isolation or quarantine requirements before they returned, and really also allowed faculty and staff some more time to better prepare campus to reopen under these circumstances. It also did, though, allow us to keep a full term or a full semester because we have been able to adjust the later part of the calendar to incorporate additional class days. So we will have a full spring semester, just starting those classes 1 week late for undergraduate students and some graduate and professional programs. We do have some professional programs in particular who did need to retain their original start dates for a variety of reasons. A lot of that may have to do with complex situations related to accreditation, clinical experiences, or other circumstances that are particular to those schools. And we've been working closely with across all 10 schools at the university to make sure that we are all aligned in our thinking and supporting one another, regardless of when we needed to resume operations.
Thanks so much. That's really helpful. Another question that relates, what was our reasoning behind having another Commodore's care period?
So the goal of the Commodore's care quiet period is really to try to minimize the risk of transmission through what are higher risk or non-essential activities, particularly larger social gatherings, during a time when we expect to have a large number of people returning to Nashville and to campus. So it's really just us asking all students to be mindful of their actions and interactions during that period, using the guidance that we provided so that we can contain any potential spread of COVID or the Omicron variant. So that's really kind of the purpose or the goal of the period.
That's helpful. And I know that we did this last year. Could you share what we've learned, if anything, from the last period that helped us guide how we're implementing it this time around?
Sure. So the similar period that we had last year was really helpful in managing the reopening of school in spring. And some of what I think we learned was really through the questions that we received last year. So we were able to tweak a little bit of the information and guidance to be more clear this time around. I also think our contact tracing efforts are very relevant here, and Pam can also speak to this, because over time and our contact tracing efforts in the past few weeks, I think have really reinforced that the types of interactions that may pose a risk right now are exactly the ones that we're trying to combat and sort of maintain with the Commodore's care period. We do want this period to be brief. And again, like I said before, we all come together and work through the Commodore's care period. We want to be able to move forward after that period has ended on January 24th.
Thank you so much. How are we going to ensure people follow the university's COVID protocols and guidelines?
So some of this is about communication, and we're continuing to message through a variety of outlets to all of our campus constituencies, faculty, staff, students, student organizations, to ensure that everyone has all of the information that they need about the protocols and guidelines. We are wanting to encourage everyone to support one another in really adhering to those. We will be having a repeat appearance from our public health ambassadors. So you may recall that those were a strong presence on our campus. Last year, they were not as active during the fall semester, but they will be assisting with reminders and support for the Commodore's care period and COVID protocols as we reopen for the spring.
Thank you. And who do we get in touch with if we see a VU community member not complying with the COVID policies, such as wearing a mask indoors or not maintaining physical distancing?
Well, certainly, again, we would encourage everyone to work together as a community to talk with one another about those things and give reminders. But if there are concerns about compliance, those can be expressed through the Public Health Ambassador Hotline reporting tool, the university's compliance hotline, or our general incident reporting form that we have available online.
Thank you so much. I really appreciate it, Vice Provost Black. I'd now like to move forward and turn it over to our next panelist today. Pam Jones, the Associate Vice Chancellor for Health and Wellness and the Associate professor in the School of Nursing and co-leader of the Vanderbilt University's Public Health and Central Command Center. Dr. Jones will talk to us about the latest COVID-19 trends on campus and what we currently know about the Omicron variant and our testing and contact tracing protocols for the spring semester.
So thank you, Ashley. Can you hear me okay? Great. Okay, so let's start with a few things. And as GL said, we are still learning about the Omicron variant. And unfortunately, it is significantly more contagious than Delta. We already know that, and than the previous variants. We're watching, we're watching very closely what is happening in communities that are ahead of us, including South Africa. We're watching what the trend lines did there. We're watching the UK, and we're also watching areas like New York that were impacted with Omicron earlier than our community. What we hope, experts do not know when this will peak, but what we hope is that it will peak quickly and come down very quickly. And that certainly is consistent with what we've seen out of South Africa at this point. So there are a couple other things that we know. We know that vaccines and previous infections with other variants, so Delta and prior variants, are less effective at preventing infection, but they continue to be highly effective against severe illness. That's a really important consideration, particularly when we think about protecting those who are the most vulnerable in our communities. Boosters, when eligible, significantly increase your protection. And I know this is controversial and there's been lots of discussion about it, but the literature is clear. If you receive a booster when you are eligible, and the CDC just dropped this to 5 months post-vaccination with several that are out there, you will increase your protection against reinfection. Also, it does continue to boost your immune system and protect you against severe illness. So again, there is some good news with Omicron, even though it's highly infectious. If there's a silver lining, it's that it's appears to be milder than Delta. And one of the other reasons that we wanted to do the week delay of start of school is the data is still early on how dangerous Omega might be, because if you think about it, hospitalizations and deaths lag infections. So people are often sick for several days before they go to the hospital, and often in the hospital for a long period of time should they, heaven forbid, pass away. So we wanted to have a better understanding of how severe Omicron is. And again, the good news is it appears to be far less severe than what we saw in Delta. One other thing to note, and I've said it before, I'm going to say it again because we're getting a lot of questions from students. Delta was the circulating variant up until about 3 weeks ago when we started to see Omicron emerge. And Delta infection, previous infection, does not protect you very well against a subsequent Omicron infection. So keep that in mind. As GL said, it's all about layers of protection still. We know that masks, particularly KN95 masks or similar product, are more effective with this Omicron variant than cloth or surgical masks. So that's sort of a high level view of what's going on with Omicron in general. And we're watching all the emerging data very, very carefully to try to be sure that we're putting best practices in place. Let me talk about campus trends. We are seeing an increase in cases in our student population, both on campus and off campus. So those individuals who are home on break and are reporting to us that they've become infected in their own community, we are seeing significant increases in that. We're watching trends, and it appears, whereas with Delta, we saw primarily household contacts and very close other contacts, boyfriend, girlfriend, that kind of situation, spent a lot of time together, were typically the ones who became infected if they were vaccinated. With this, we are seeing spread in what we think of as friends groups, or clearly household contacts, but also friends who spend a lot of time together. So again, more indication that it is more contagious. And that's part of why, again, as GL said, we want to have this calming down period as we come back to campus to keep some of that from happening. The vast symptoms we're seeing are mild and most resolve within 2 to 5 days. So that's good news in our student population. And we are watching all of these trends very, very closely. The contact tracing in the command center that we've always had are still in place and are working very hard to actively manage this situation in partnership with student health and all of our other great partners dedicated to the health of our campus. We have implemented already the new CDC recommendations that change the required isolation period to 5 days. That's assuming your symptoms are resolving and you have no fever without fever reducing medications for 24 hours, followed by another 5 days of wearing a tight fitting mask. And again, this is where a KN95 masks are the most effective. And that's great news as we think about the implications for students being in isolation and being able to get them out as soon as safely possible based on the CDC recommendations. We've automated part of the contact tracing process that uses a survey to streamline that process. It makes it less time consuming for both the students and for those of us involved in the contact tracing activities. So if you test positive through our system or report a positive test to the command center, please watch your email for communications about that, and we can handle much of that virtually. GL mentioned the testing program, and let me hit the highlights of that. You're already aware of students who are required to test before returning to campus. That's because we want you to be able to isolate at home versus here, should that need be, and also protect others as you travel here. For the spring, we've enhanced the testing program again, and we're going to do 2 times a week testing for individuals who choose not to provide proof of full vaccination. We're going to do 1 time a week testing for those who are eligible for a booster, but who choose not to provide proof of a booster. And then we're going to do the Sentinel testing program like we did last semester, where we just pick a sample of individuals who are fully vaccinated and boosted and do a small sample each week to give us a feel for what's going on our campus. Systematic testing continues to be available through the student health and other community resources. We're really lucky to have this because we know many of you are in communities that testing's really hard to come by. We are really lucky to have our partners at BUMC and our student health partners who can provide that testing in a very timely manner with a good turnaround time still. One point of clarification, because we get this question a lot. If you have been positive, you are exempt from testing for 90 days after being positive. And all we need to exempt you is either you've been tested through us, so we know about it, or you report your positive testing. So let me hit just a couple of final messages. And again, get a booster if you're eligible. It's the best way to protect yourself and those around you. I know how frustrated everyone is with this. We are all really frustrated and tired, and it's emotional and the uncertainty of it all. But our ability to really be together as a community, and we've got to do what we need to do to make this work. And unfortunately, there's no easy or perfect answers to this problem. So we just need to work together, as Dean Black said. So I'll stop there and take questions.
Thank you so much, Dr. Jones. All of that was very helpful to learn about the many efforts our campus is taking. We wanted to follow up with a few additional questions, and some of which you've actually hinted, but I think is really important for us to just make sure it's very clear for everyone. The first is, again, some students have expressed concerns about being able to access and find COVID tests to submit upon their return to campus testing and their arrival back to campus. So can you talk through one more time all of our options?
Sure. So we do want you to try to test in your community if you can, and think of resources like the city and county health departments often have testing available. You know the resources in your own communities, and again, we want you to do that for 2 reasons. 1, we want you to be able to isolate at home, and 2, we want to keep it as safe as possible for others as you travel. But if you don't have an option at all, and some people don't, we've already heard from students who don't, you can test when you get here. And we don't want that to be a huge source of anxiety. We really didn't want to be open on the MLK holiday because we really wanted to, allow everyone to be off on that holiday. But we did open the testing center for that day because there are a lot of people coming back to campus on that day. So that testing center will be open, and those testing times for that center are posted on our website.
Thank you so much. And while we hope this is not going to happen, the second question I have for you is, what is Vanderbilt's plan if we were to experience a major outbreak or an influx of new cases?
So we know we are going to have a spike. So the question is, how high will that spike be? So we have prepared quite well for that, and that's part of why we delayed and did all the things we've already described. But as always, we have remained facile throughout this pandemic, and we meet frequently with senior leaders. We have a number of contingency plans that could be put in place. Our main goal is to do everything we can to support in-person, learning experiences and that campus experience that Dean Black talked about. So we have a game plan, and we will watch the trends very carefully and be very, very responsive, as we always have.
Thank you. And this next question is a little longer, so bear with me. Looking ahead to once Omicron wave has passed, what kind of metrics and endpoints are being used to determine when masking requirements or other restrictions should be relaxed on our campus? So for example, are we looking at cases, transmission rates, vaccination rates, hospital capacity, or are we focused on campus numbers, Nashville's community members, national numbers, or anything else?
So that's a great question. And the answer is all of the above. So we look at everything that's available. We look at trending data from, as I said, other countries and other regions of our country. We use the experts that we have, incredible experts at VUMC who do predictive modeling and all kinds of really fancy stuff and research. So we look at all of that. We look at what are the hospitalizations numbers. So for example, if we find that Omicron is extremely mild, then hospitalizations don't skyrocket and we don't see people who are severely ill, we wouldn't be as concerned about case counts. That would not be our measure. So it's really looking at all of it, consulting all of our experts, and then bringing that all together for the best decisions possible. Plus the CDC recommendations are always important to us, and the local health department recommendations as well.
Thank you. That is really helpful. And my last question is actually going to be for both you and Vice Provost Black. In our communications to students, we talk about adjusting our testing program. What changes, if any, will happen to our quarantine and isolation protocols?
So we will change our isolation and quarantine protocols based on the CDC recommendations and just the situation on the ground. So there's no plan changes right now because we've just implemented the new ones. But every day is a new day with COVID. So Dean Black, did you have anything to add to that?
No, I think that covers it for now.
Wonderful. Well, thank you both. And yes, we are staying on our toes and we're really grateful for you, Dr. Jones. I'd like to now welcome Assistant Director of the Office of Student Care Coordination, Jamie Hardy. Good afternoon, Jamie. How are you, Dr. Hardy?
Doing well, Dr. Brown. Good to see you and all of our students here.
Wonderful. So I want to start with questions with you. And my first question is, we are now going into almost 2 years since this pandemic began and the effects it's had on our students' mental health and well-being. Can you tell me how the university is working to support its students through support services and resources, and what changes have we made since the pandemic began to expand those support to our students?
Sure. Thanks for that question. So I want to start by saying that we know that the mental health and well-being of our students have been significantly impacted by the pandemic and also by some of the protocols that are just necessary in order for us to maintain our safety as best we can. And so we know at Vanderbilt, we love our data because we are a data-driven institution. Over the past 2 years, there have been a 16% increase in the number of students who have utilized or the number of appointments rather that have been scheduled with our mental health providers. And so while 16% may not sound like a large number, that's 1,300 appointments. So the first thing that the Student Care Network has done to address that concern is to expand our staff in all of the offices. So the primary offices of the Student Care Network are the Office of Student Care Coordination, University Counseling Center, the Center for Student Wellbeing, and the Student Health Center. And so each of those offices are hiring individuals in terms of medical providers, counselors, coaches, even care coordinators, so that we can expand availability and support and care for our students. Also, with those expansions in terms of hiring, have come our opportunity to hire a more diverse staff. So we have the opportunity now, have and will continue to hire folks who have diverse identities. We've also enhanced the cultural competency training for all staff and support staff. And we've also been able to expand some specialized care options for students in marginalized communities. We've been able to maintain both in-person and virtual appointments. And now I'm happy to report that all Student Care Network offices have drop-in hours. So we do still offer scheduled appointments, but we do know the benefit of having students be able to access us when they need it at any given time. So those have been scheduled. Students can visit the individual offices of those different Student Care Network primary offices, but I also encourage you all to visit the Student Care Network website, especially the satellite services tab, where you'll be able to see some additions as they become about for the semester as things are changing. But that is a centralized location where students can find some of that information. The other thing that I wanted to make sure to share was we have this year added a program called Academic Live Care, which is a 24/7 telehealth platform where students can access free physical and behavioral health providers. So that includes psychiatrists, therapists, and nutrition consultants. And given the uptick of the just demand in mental health and well-being services, as well as physical health services, that has been a great addition, because I know that I'm talking live with students, and I know that many of you all have utilized our service. Academic Live Care did a big update in the middle of last semester. So if you have been utilizing Academic Live Care and are currently experiencing some issues, go ahead and create a new account, and that will put you online with their new software update.
That's wonderful. Thank you so much, Dr. Hardy. We really appreciate all the efforts that the institution is making, and specifically your office, for supporting our students. Our next panelist is Andre Churchwell, Vice Chancellor for Equity, Diversity, and Inclusion. Dr. Churchwell, before we jump into questions, can you tell us a little bit about what the university is doing to support students, as well as all the members of our campus community, and making sure they feel a sense of belonging in our community? Don't forget to unmute.
The little blue light came on there. Thank you. Ashley, you're very much involved in the process of us building a sense of belonging on campus, so I will certainly spotlight you. We recognize that everyone, students, staff, faculty, Vanderbilt leaders have a role in creating a sense of belonging on our campus. Our chancellor has made belonging an important goal for all of us to achieve. The Office of Equity, Diversity, and Inclusion has a giant role, as you well imagine, because in many cases, the members of our VU community, and for that matter, our national community, who are struggling with belonging, are members of our minority or underrepresented groups. These are our key stakeholders for our office, I might add. As part of the Chancellor's commitment to the concept of belonging, the Chancellor challenged my office, I might add, to develop a set of metrics or tools to evaluate our programs, our EDI programs across the campus in terms of how they move in the metric, moving the meter on the process of belonging here on campus. We recently created an interdepartmental group, a belonging measurement task force, so to speak, that's comprised of those offices and groups on campus that have a role in developing belonging tools here. Those members include, but are not totally connected, I can't list the whole group because there's too many, but I want to outline a number of key members. Vanessa Beasley, our Vice Provost of Academic Affairs and the Dean of Residential Faculty, is very much involved. You can see the residential faculty would be very much interested in how we develop belonging tools. Ashley Brown, our moderator, Director for the Student Center for Social Justice and Identity, very much involved in our identity centers and their development. And members from my office, and then Jermaine Soto, Director of Faculty Development from the Office of Faculty Affairs, and a host of other people are involved in this, all very keenly involved in working with us to develop these belonging metrics. I think before we actually talk a little bit more about that, let's talk about belonging itself. Our task force spent a good amount of time, as Ashley will recall, trying to develop a definition of belonging. What does it mean? We looked at belonging in kind of a flywheel phenomenon. To get to belonging, you have to have diversity, which we have in spades here at Vanderbilt. We have one of the most diverse student bodies in the country compared to our peers. You have to create a sense of community, a welcoming sense, a known sense of community, an accepting sense of community, supporting sense. You have to have inclusion built in, support, heard, befriended, connected. And then the belonging occurs in that flywheel till you bring about a sense of need, care, a sense of caring, and a sense of being present for people when they need it. And then you bind that all together with a lot of mentoring and faculty and staff and student leadership involvement. So as we looked at the definition, we felt that it's belonging as a feeling of support, security, and acceptance of differences. Individuals experience belonging when they feel that they matter, are valued, respected, and cared for as members of the community, and which leads to relationships and connections to ensure that each person receives what they need to thrive and fulfill their full potential while here at Vanderbilt. Our task force has created a belonging survey tool that will be used to assess belonging twice a year in the fall semester and the spring semester, biopsying that. This will aid and guide us in evaluating our EDI programs almost in a real-time sense that exists across the campus, and that will enable us then to pivot, adjust, and modify these programs based on what our survey tools tell us. If I may add a couple of additional key points or tools that we are using to drive a sense of belonging, they would be the Vanderbilt Way. You've heard about that from the Chancellor. The Vanderbilt Way, as defined by the Chancellor, is in itself a definition or ethos of belonging for all who are in our Vanderbilt community. The Vanderbilt Way is based on deep inclusiveness, as reflected by its all-in motto, and the One Vanderbilt concept that was mentioned earlier, that we all are constantly growing together, supporting each other. That's an inclusive community. So that's foundational, right, for building a foundation of belonging on this campus. We're also creating those metrics and tools for all the VU community to engage in more constructive civil conversations. Nationally and on our campus and across other campuses across the country, we have seen heated polemics occur when thoughtful exchanges should occur. These occur when discussing very difficult topics, and we've seen it occur on national TV, we've seen it occur on our campus, we've seen it occur across campus. We have a team that's working with the Office of Diversity and Inclusion to create and promulgate these tools. Ashley's involved in that too, I might add. You can't have a shared sense of belonging if you can't respect and accept different points of view from your own. Lastly, the Chancellor and the Provost have merged all the ED work on campus under my office of the EDI, Office of Equity, Diversity, and Inclusion. This helps for accountability. You're looking at the most accountable person here on campus now, and allows my leadership team and I to embed in all our programs the Vanderbilt Way and our belonging strategies under one roof, our roof, for all members of our Vanderbilt community. That includes staff, students, faculty, and when relevant, alumni. Thank you again, Ashley, for giving me time to talk about this, and I look forward to any questions.
Thank you so much, Dr. Churchwell. It's been a pleasure working with you on many of these initiatives, as well as the impact it's going to have on our students and overall community. So I'm now going to jump into questions that were submitted by students ahead of the town hall. Also, while some of these questions are filtering in live from our audience. And because this is very much related to what Dr. Churchwell just mentioned, I want to start with Dr. Hardy. There's a question that was asked about how do Vanderbilt plan to account for challenges regarding student mental health this semester, particularly with the isolation that they may be feeling during the Commodore's care period?
Thanks for that question. So, as I mentioned, we have expanded our drop-in services. That also includes virtual drop-in, and all of any appointment that you have that is in person, and perhaps you are quarantined, or there's another reason why you just may not feel comfortable to attend an in-person appointment. Any of those appointments can be transitioned into a virtual appointment. So that's one of the ways. And then also, I did see another question about what is academic live care. That is a telehealth platform that students can access therapy. You can go to the Student Care Network Self-Directed Tools tab on that Student Care Network page to see more about that. But that is an opportunity for students to receive completely 100% teletherapy, so that we're able to still provide students with support, but in a way that's best for them and best for our community.
Thank you so much. That's really helpful. This next question is going to be for Dr. Jones and maybe even Dr. Churchwell. How can students access COVID tests with equity when there's a national testing shortage? Is there a price barrier to a population of low-income students with pressure to test in order to perform the necessary campus duties that impact finances and education?
Well, I'll start with that, Ashley. And you know, it is true that in different communities, as I said earlier, there's huge variation in what testing is available, what that testing costs, you know, and how much individuals can acquire that testing. So what we've done is we pay for all the testing that our students need here on campus. So on our campus, there is no issue with that whatsoever. And we always work through, you know, GL's office and others to support our students who need support in all kinds of ways. We know, and Dr. Churchwell can add to this, we know there's tremendous health inequities that have played out in the COVID pandemic. And that's one of the most tragic parts of this pandemic, actually. So I'll let you comment on that, Dr. Churchwell.
Thanks, Pam. One of the things that some of our audience may not know, I'm actually a physician. I'm a cardiologist, professor of medicine at the Vanderbilt University Medical School and Medical Center, and had worked with Pam on a lot of other projects related to health disparities too, I might add. This past year, we did a couple of COVID webinars. I'd recommend you go on our website, our Office of EDI website, where we address this. Thank goodness within our campus, we don't have this issue of people not having access to the test based on finances, but in the general Nashville and the national community, that is a big issue. There are larger issues around lack of access due to cost, but even more importantly, we had to come around to the fact that we had to put the testing centers in those locales in the cities where our more marginalized groups live, and whether that be in New York, Chicago, or the like. We saw disparities in testing initially. People of color, of marginalized status, were not getting tested at the rate that they should have been. Once those tests were begun to take place, we began to see staggering differences. Rates of positivity much more prominent in our Latinx, in our African American, and even more so in our Native American communities out west. As we saw those disparities, they were all connected to the social determinants of health. Many of our people of our marginalized communities are dealing with poverty. They're dealing with lack of access to healthcare, dealing with access to medications. They're living in a psychosocial stress environment, which predisposes them for infections such as COVID. So the rates of infection are higher. And unfortunately, mortality and morbidity is much higher in those populations. If you compare African American and Latinx, it could be twice their comparable white counterparts. In the Native American or the indigenous communities out west, it's maybe 3 times in terms of mortality. So I think it is certainly a great challenge that we've had to come to grips with here in this country around health disparities. And they've existed for years, but COVID has certainly shown a bright spotlight on health disparities.
And Ashley, if I can jump in real quick, just with a couple other things that may be helpful here. So as Pam mentioned earlier, one of the things that we are doing is if students are unable to complete a test before they come back in their community for whatever reason, they are able to test at the testing center. But also from a practical standpoint, we do have funding available through the Student Hardship Fund and the Student Care Assistance Program. And so I just want to make sure people are aware that if you are experiencing a challenge with obtaining a test and there's a financial barrier there and you would like to explore those options, you are welcome to reach out to us at deanofstudents@vanderbilt.edu, and we can help walk you through those processes and see if there's something that we can do. And ultimately, like we said, if that's not feasible, we can utilize the testing center here on campus.
Thank you. That's really helpful. And Dr. Jones, just as a follow-up, for pre-arrival tests, are at-home tests such as an antigen test acceptable for returning to campus?
We will take whatever you can get. So yes, antigen tests have come a long way. They're still not as reliable, and we know that. But because of the shortages of testing places, it's acceptable, and there's a way to just upload a picture of your at-home test on your attestation that you were either positive or negative.
Awesome. And I'm going to give you just a scenario. So if my student had COVID over the holiday break and she has a documented PCR positive test result from the lab, does she still need to test 72 hours before arrival on campus? And if it helps, if she's off campus, if that makes any difference?
Yeah. No, remember I said if you have tested positive, you are exempt from testing for 90 days after the positive. And the reason for that is because you can continue to test positive when you are no longer an active spreader of the disease. So but you need to provide us information in the command center. And there's a way on the website to go and complete a REDCap form and submit your proof of your positive test. And we also accept at-home tests for that as well. It doesn't have to be from a lab. If you've got your little test and it's got two bars on it, take a picture, send it to us, and report it.
Thank you so much. Relating to guest speakers, Dr. Jones, are guest speakers going to be allowed in academic buildings and classrooms? Last semester, we were told that visitors were not allowed in non-academic buildings and had to be masked.
So last year we had guest speakers, and we did reinstitute masking for them. There was a point in time where we allowed, last semester I should say, we allowed guest speakers when the community prevalence was low who had documented proof of vaccination to not wear a mask. Everybody's universally masking right now until this Omicron thing passes through. So guest speakers are allowed. We believe that's an important component of many of our classes here and a enriching experience for our students, but they'll be masked just like their professors will be for a while.
Thank you. And this is very related, and this will be for Vice Provost Black. Can you talk about the decision to not allow students to attend sporting events, but to open games to the general public, and specifically why are students not allowed to do that when outside community is allowed?
So yeah, thank you for that question. And we've fielded a lot of communications about this, and we understand this is really disappointing and we wish we were in a different position. But I think this really goes back to the goal of the Commodore's care period that I talked about before, where we're really trying to minimize the risk of transmission through certain activities when we have so many people coming back all at the same time. And our focus here really, when we think about the Commodore's care period, is our focus internally on our Vanderbilt community, where we really need to be able to reopen and ensure that we can stay fully operational and not overwhelm all of our systems. So that's kind of what our goal with the period is. I will say, because we know this is very disappointing and we want to support the men's and women's basketball teams and show our school spirit, we have been working around the clock here recently, as this has kind of come to light, to figure out how can we have some events and activities to bring the community together to support the teams. So I know it's not the same as going, but we do have a number of projects that we're doing. So for example, we actually have a pre-show performer, Red Panda, before tonight's game, who's a variety show performer, I'm told. And there was an email that was sent. You can sign up on AnchorLink for that. On Thursday night for the game, we are going to have a pre-game Zoom room where students can join and be shown up on the video board during the game. We're working in close partnership with athletics on this. So that'll be up for sign up later this week on Thursday in AnchorLink. And then for next week's games, we're planning some virtual fan watch parties for both January 18th and January 20th. And we're partnering with Campus Dining and Athletics to do some sort of snack and swag kind of bags. And we'll hopefully be able to have those distributed around campus for people to have, and then come together to watch the game virtually. And then I know we're also working with athletics about, once that period is over, is there anything else we can do to celebrate a return to going back to the games? And so we're working with them on some other opportunities for some welcome back activities after that. So I know it's not live attendance, but we still do want to support the teams and understand that that's a real challenge for everybody right now.
Thank you. That's really helpful. And this is also going to be for you, Vice Provost Black. Will there be a remote option so that students who are isolating or are in quarantine can keep up with their academic work?
So we will continue much the same way that we did last semester, with the focus being on in-person instruction. This is one area where the shorter isolation times may actually be really helpful in alleviating some of the concerns around this topic. As we discussed many times over the course of the semester and in a lot of the communications, the Vanderbilt faculty have, continued to develop a variety of mechanisms through Brightspace and in partnership with the Center for Teaching, in order to provide ways for students to keep up with their coursework if they have to be out of class for any reason, whether that's isolation or some other reason. And we had some really interesting approaches that different schools and departments have taken, history department, law school, where they have used various tools to record lectures and class discussions. Some of the faculty have created supplemental videos on particular topics that students can have access to, and then can actually be helpful in referring back to those later as they continue in the course. Expanded office hours, providing materials in alternative formats, lots of technological and other kind of informal solutions. So the faculty, the great thing is they're developing more and more and then sharing those. And so, hopefully those opportunities will continue to be fruitful and spread across the faculty and in all of the schools to support the students who may need to be out of class.
That's really helpful. Thank you. My next few questions are going to hit on spring break, and then I'm going to transition into dining. My first question is going to be for Dr. Jones. What are the university's plans for monitoring and controlling any surge in infections due to the potential for student travel during spring break?
So we'll do what we've always done, which is monitoring testing results, contact tracing, and case management. And the resources are all in place to do that. It's not like the original year of the pandemic with spring break that we didn't know what was going to happen. And so we'll be watching, we will make adjustments. We're really hoping that this surge passes pretty quickly and we get back to a little more baseline like we were last fall, which means spring break won't be a huge problem. But we'll be responsive depending on what the conditions on the ground are at that point in time.
Thank you. And Vice Provost Black, the burning question on many students' minds is canceling spring break and instituting an in-semester reading days, which means no class or assigned work, something that the university is considering.
Thanks for that question. I would say no, not at this time. As I mentioned before, when you asked a little bit about the calendar changes, so one of the really key considerations for us as we evaluated the calendar for spring was preserving spring break. And I think there was very much a consensus across the university that that was really, really important to be able to take that time and for students to be able to take that time to rest and recharge and take a break from academic work. And that is a much more supportive approach in terms of their mental health and well-being. And so I think we're very hopeful that all the adjustments that we've made with this shifting of the calendar will be sufficient. And like I said, we can get through the Commodore's care period and then move forward with the semester as is.
Thank you. This question again is going to be for Vice Provost Black. What is being done to support students who have tested positive to make sure that they have access to food and specifically access to support for their classes without needing to expose others? Overall, what is being done to improve the dining situation for students needing to isolate or are in quarantine?
Yeah, thank you. So the basic procedures that we have for isolation will remain pretty much the same. And so for those of you who aren't familiar with that, if you're thinking about what you might expect if you were to test positive. So for all of our campus residents, we reach out to our housing team. Our isolation housing team reaches out and has a phone call, connects with the student to talk through the instructions for isolation, what to bring, what to expect, goes over all of the avenues for support that may be available, and also does provide information about our isolation meal plan. So students do receive money to use on Grubhub, and we used to have a prepackaged meal delivery system, and the Grubhub option actually, we have found provides a lot more flexibility, both in terms of options, but also in terms of timing. So with a meal delivery system, one of the challenges that we would run into is the meals are delivered during a particular window. And sometimes that was challenging based on a student's, if they were doing their homework or they were sleeping or resting, and we don't want people obviously to miss meals. So the Grubhub money allows for a lot more flexibility for people to order food and eat on their schedule, what works best for them. We do supplement that from time to time. For example, as many of you probably know, we had a very big snowstorm at the end of last week. And one of the challenges, obviously, when there may be a dearth of Grubhub drivers who can circulate around the city. So we did work with Campus Dining, and they were very helpful in terms of prepackaging food and meals that we were able to deliver door to door to those who were in isolation or quarantine. So we shift, and as Pam said, I think we try to remain adaptable and agile so that we can address any circumstances that come up. But that's the basic operation still for our isolation.
Thank you. That's really helpful. And Vice Provost Black, you mentioned this, but I just want to reiterate it because it's come up a few times. Does the delay in start of our spring semester affect final exam schedule for students, particularly undergraduate students? And how, if at all, will it affect the final grade calculation or graduation honors determination?
So if you look at the new full academic calendar is posted now, I believe. So you can find it online. So if you look at it, essentially what happens is we've added those additional days of instruction at the end of April to make a full week of instruction that last week of April. And then we have 2 sets of reading days on the weekends with a finals period in between, and then going a little bit beyond that second set of reading days. Like I said before, there's no interruption for graduation activities and ceremonies. And I don't remember off the top of my head when grades are due and things, but that's certainly something that we can look at and provide some follow-up information about.
Thank you. That's super helpful for students. And my next question is going to be for Dr. Jones. Is there any chance that the Commodore Cares program will be extended, and what will determine that? And if so, what would that potentially look like?
So there's one thing I have learned with COVID, and that is I never say never. However, we will do everything we can to not have to do that, because we recognize, how impactful that is to our student community, to our whole community, frankly. And everything we have done and are continuing to do is to support that campus experience. So we will watch cases, as I said, we'll watch severity of illness, because if it's not making our population sick, then we don't have to worry about it as much. So we'll watch all of that, but and we meet all the time to talk about these kind of things, and we'll continue to do so.
Thank you so much. And my last question is going to be for both Dr. Jones and Dr. Churchwell. For students with disabilities or students who are immunocompromised, what resources are available for them if they don't feel safe on our campus right now?
So go, you want me to take first?
Yeah, Pam, you
shot
go.
at it? Okay.
Yeah.
So, just like any students who need accommodations, we would ask them to work very closely with our team that looks at accommodation needs. And student health, most of those students are actively followed and by our student health center. And student health has been a wonderful partner in terms of working through individual cases and the individual scenarios of when those students should be released to come back to campus, those types of things. So we'll use all those typical resources we have. And we do know that there are groups of individuals who are more vulnerable to COVID than others. And we want to be sure we're very attentive to that.
I would only say that our office will get occasionally a call from about something like this, and we are very quick to pass it on to our student health leadership, and certainly to Pam to answer any questions like that.
Thank you. Thank you both. And I sort of lied because I do have one more question. And this one's going to be for Vice Provost Black. And I just want to make sure that students and our parents feel really, really comfortable around the dining experience. So if you can just go into detail about what dining will look like for this semester in general, and what can students expect who aren't in quarantine or isolation to experience when it comes to dining for the semester?
Yeah, thank you, Ashley, for that question. And I know dining was certainly one of our hot topics from the fall semester for sure. And we were obviously, we were combating a lot of supply chain and staffing shortages and a lot of challenges in that area. But campus dining, we work with them, or the Dean of Students office works with them very closely, and they have really continued over the course of last semester and then transitioning into this semester to really try to continue elevating the dining experience on campus. So there are some updated announcements that I'm happy to share here, and then more information will certainly be available from dining directly. We do have for spring semester additional stations at pretty much all dining halls will be open. So one of my favorites, bowls, will be back at Rand Dining Center. So the bowls and smoothies will both be back at Rand Dining. Made to order craft flatbread pizza or flatbreads at the Commons, and a custom omelet bar at E. Bronson Ingram. There's also a new hearty pierogi bowls, which is going to be a rotating dinner option at the Commons. We also have some changes in terms of hours. So Rand Dining is actually going to open the spring with a continuous service, so no gap between breakfast and lunch. And then the residential dining halls at Zeppos, E. Bronson Ingram, and the Commons are all going to remain open a little bit later than they were previously, until 8 p.m. nightly for dinner service. A couple other highlights. So at Kassam, there is a good option for lunch and dinner, the kitchen at Kassam, and that is going to be open for breakfast from 7 a.m. to 10 a.m. on weekdays, and on weekends for brunch from 10 a.m. to 2:30 p.m. Saturday and Sunday. And they have a lot of gluten-free items for those students who are gluten-free. And then building on the popularity of meal plan sushi, our markets team is going to be adding sushi and bubble tea meal plan combos at the Highland Munchie Mart. which will be available from 11 a.m. to 2 p.m. weekdays over at Highland. So these are just some of the enhancements that Campus Dining has been working on. They are going to continue updating their website and other information. And if you would like to subscribe to Dining News text alerts, you can text Dining News, all one word, to 55744.
Thank you so much for that update. I'm really excited about some of those offerings. I enjoy bubble tea. It's nice to know I won't have to leave campus to find some. All righty. Well, I want to thank you all for your responses. It has been really a pleasure spending this time with you. However, we are at the end of our time today, and I want to give my special thanks to everyone who submitted some questions. We are also keeping a record of any questions we did not get to today, so we can address them in the Health and Safety Protocols website. So keep an eye out for that. A recording of this town hall will be available and for your later viewing. And I also just, again, want to thank so much our panelists for being here, and thank you for attending for everyone else. This concludes the town hall, and I hope you have a great rest of your afternoon.